My name's Corey.
No.
I'll be doing your exam today. Get on the patient's level. First off, I'm going to start by inspecting your scalp for any lesions or anything like that. Okay, now we're going to take a look at your eyes here. So what I'm going to do is I'm just going to need you to stare straight forward, and I will shine this light in your eye. All right. Perfect. All right. Now, what I'm going to need you to do is if you could follow this with your eyes. All right. Now I'm going to take a look in your eyes. All right. Take a look over here. Keep sure you're staring straight forward. Perfect. All right. I'm going to take a look in your ears real quick. So if you want to turn this way forward. I'm going to take a look at each ear. Okay, let me come over here to this side. Take a look inside this ear. All right, we'll take a look in your nose here. If you can look up. Okay. Palpate the sinuses here. And also start palpating the lymph nodes. Start with the occipital, and my way down. Here, back, chain, here, and then you can see if trachea's midline, which it is. And I'm going to place myself behind the patient here and palpate the thyroid gland here. And now we're going to test some hearing. So I'm going to whisper something in the patient's ear and she's going to repeat it back to me.
Blue. Yellow.
All right, her hearing's intact. Come back here. Also do a few more hearing tests. The tuning fork here. So just tell me if you hear it equally in both ears.
Yes.
Okay. Test in this ear. Tell me when it stops.
Stop.
Can you hear it now?
Yes.
Perfect. Over here. Tell me when it stops.
It stopped.
Can you hear it now?
Yes.
All right. And we'll test tongue movement and motion here. Can you press on my hand with your tongue here? Perfect. Press on with your tongue here. You know, Perfect. We're going to test for taste now. Dipping this in a substance and putting it on her tongue. What's that taste like?
Sweet.
Okay. And now we're going to test gag reflex. Say ah for me. You open your mouth. Okay, perfect. Double mucosa. Perfect. Okay. Now I'm going to need you to close your eyes for me. Now, tell me what you smell.
Coffee.
Perfect. All right. I'm going to test your corner here. Perfect. Perfect. All right. You feel me touching you?
Yes. 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 Yes.
All right. Tell me if it's sharp or dull.
Sharp. 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 Dull. Dull.
Perfect. You clench your jaw for me. Awesome. Can you smile? Raise your eyebrows. Puff out your cheeks. Take out your tongue. Perfect. All right. Now, I'm going to need you to shrug your shoulders. Awesome. Turn your head against my hand. Good. Turn your head against my hand. Awesome. Yeah. test muscle strength. Grab my hands, or grab my fingers here, squeeze. Good. Hands like this. Don't let me pull, don't let me push. Awesome. I'm gonna test your legs here. So push out, against my hands, pull back, awesome. Push down with your feet, good. Pull up, good deal. All right, so do rapid movements here. I'm gonna need you just like this. Thumb to each finger, good. Now, this on your legs. Perfect, point to point, so if you can touch your nose and touch my finger. Again, again, one more. Good deal. So I'm gonna need you to stand up. You can stand up, and I'm gonna need you to walk heel to toe, about to the edge of this, and then turn around and go back. Good deal. All right. Awesome. Okay. You have a seat here on the chair for me. All right. So I'm gonna need you to tell me whether you feel sharp or dull. I'm gonna touch your arms and legs. Okay.
Sharp. 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 Dull. Sharp. Dull. 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 Dull.
Perfect. Have your hand here. Now close your eyes. Tell me which number I'm writing.
3.
Perfect. Another hand here. Tell me which number I write.
10.
Awesome. All right, now we're going to check your reflexes real quick. If you just let me have your hand here. Biceps reflex here. Awesome. Check your triceps here. Good. Just relax for me. Wiggle your toes if you want to. Perfect. Good. Go over here. Biceps over here. Good. Triceps. Relax. All right. Over here. Wiggle your toes. Good. Good deal. Knees here. Just let your feet dangle. Relax. Good. Good. Now, I'm going to hit the back of your ankles here. And all I'm going to need you to do stand up for me. All right. Feet together. Close your eyes. This is Romberg's test. Okay. All right. Open your eyes. Put your hands out front. Good. Good deal. All right. If you want to have a seat there, examining table. So at this point of the exam is the lung exam, the thorax exam. I would inspect the chest and the skin of the thorax, both posteriorly and anteriorly, but due to the video, I'm going to keep the clothes on here. So I'll inspect all the skin, and I would then listen to the lung sounds here. Take a deep breath through your mouth. Good deep breath. Good deep breath. All right. Now I'm going to listen to the heart sounds. PMI. Mine is a cardiac stethoscope, so I was able to listen with both the bell and the diaphragm. I'm now going to palpate for any thrills. I'm going to palpate the PMI. Check for any heaves. All right. Now, just for the purpose of the video, I'm going to ask the patient to stand up and face the opposite direction so I can sit down on the opposite side of the bed here so I can check the lung fields posteriorly. Just take a deep breath for me. Again. 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 One more. All right. Perfect. If you could face this direction, stand up and face this direction for me. Now we're going to check. Sit down. We're going to check all your pulses. So we'll start with the radial pulse here. Go to the radial pulse here. All right. If you could lay back for me on the exam table, I'll move to the patient's right. I'm going to check the carotid pulses here on both sides. All right. And now I'm going to check the patient's heart sounds laying down. With the aortic, pulmonic, tricuspid, kind of leaning at the PMI for the mitral region. Perfect. I'm going to then check the femoral pulses here. Good. Then check the popliteal pulses here. Popliteal pulse here. Patient raise her leg up, and I'm going to check the dorsalis pedis pulse on the top of the foot here. And here. And then I'm going to check the posterior tibial pulses here. All right, now I'm going to check all of her joints for any deformities or inflammation. I'm going to start with the hands here. Work up to the elbows. With the shoulders, as well as on this side. Check the knees. Feet here, check all the joints here. This side. Okay. Now, I'm going to check her TMJ. Can you open your mouth for me? Good? Close? Perfect. Palpate the muscles. All right, good deal. So, I'm going to have you put your hands out like this, permitted. Have you turn them up, turn them down. Good deal. Open and close your hands. All right. I'm going to need you to let your arms straight down, flex them. Okay. I'm going to need you to take your shoulders, both hands, up above your head. Okay. Now back behind your back. Good deal. All right. I need you to flex or extend your knees for me, straight out. Okay. Flex them, back. So bring them back down. Good. And then now I'm going to need you to give me your ankles and point your toes down and back up to the ceiling. Perfect. So that includes range of motion testing. Now we'll do just a little passive motion and strength testing as well. Already tested the hands, so what we'll do is we tested the elbows as well. So I'll put my hands here, and I want you to raise your shoulders up like this. So raise your shoulders up, and don't let me push them down. Good deal. All right. And we tested the strength in the knees earlier, as well as the ankles. So if you could lay back for me, we will check. Can you shoot up on the bed for me? Perfect. So I'm going to ask the patient to bring up her knee to her chest. Here. Good deal. Any pain? Mm-hmm. Okay. And while she's up here, what I will do is I will check for external and internal rotation here, as well as assessing for crepitus. And I will do posterior and anterior drawer sign here, setting on the patient's foot, grabbing the knee here, pulling back, and then pushing forward to check for the PCL as well as the ACL injury. I'm then going to have the patient straighten her leg, put my hand over here on her hip. I'm going to check for abduction as well as adduction here. Perfect. Good deal. And then we're going to switch to the opposite side and do the exact same thing. Have the patient bring her knee up. Any pain? Okay. Says for crepitus. Says for internal, external rotation. And then drawer sign here as well. Pull, push. Have the patient straighten her leg. And then adduction and abduction testing on this side as well. Now it says for cervical spine tenderness, can you touch your chin to your chest? Look up at the ceiling. Can you look left? Look right. All right. Have the patient stand up. Look the opposite direction and bend over at the waist. Says for scoliosis. Okay. And you lay back on the platform. You'll get to the patient's right. Now inspect the skin of the abdomen. I will then auscultate all 4 quadrants for 15 seconds apiece, but due to time in the video, we'll speed it up a little bit. We'll then auscultate bruits using the bell, starting with the aorta. Move to the renal arteries. Move to the iliac arteries. And down to both femoral arteries. From here, we'll percuss in all 4 quadrants. And from there, we will move on to light palpation, noting for any tenderness or masses. From here, we'll go to deep palpation with both hands, noting for any tenderness or masses. In all 4 quadrants. We'll then assess for rebound tenderness. So I'm going to push in, and when I let up, tell me if it hurts.
No. 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 No.
All right, perfect. Now we'll palpate the organs, starting with the liver. Put your hand under the right flank here. While you're pressing up, press down. Liver's non-palpable here. You can actually do the kidney as well. The kidney is non-palpable. Move over to the spleen here. Palpate here. Nothing there, as well as the kidney here. Nothing there. And palpate the aorta for any pulsations. I'll then have the patient sit up and look the opposite direction. Check for CVA tenderness. Tell me if you feel any pain here.
No.
Pain here.
No.
All right, and that concludes our exam.